This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. I'd love to take your phone calls. Let's talk about what's going on with you and your health. 888-630-9625. That's 888-630-9625. Perhaps you've had a problem. You've tried, you've applied, you've done all those things that, everybody told you what to do, and it hasn't worked, has it? Well, here's an opportunity. Let's see if we can figure it out without drugs, without surgery, and put a new light on the subject. Something that you hadn't thought about? Well, here's an opportunity. Let's get it done. We're going to talk about a subject today because I have the time and I have the opportunity and I have the motivation, and it's called your brain. And your brain is atrophying every day you get older. It's breaking down. But you know what? It doesn't have to be that way, because there's many things that causes the brain to shrink, and subsequently with that increases your risk of cognitive decline. Memories go out the door. You don't know who you are or where you're going. In addition to that, it decreases your lifespan. When your brain's not working, you're not going to be around here too long. So we're going to touch on those things today. We're going to try to get you to understand that you still have control, that it's not a have-to situation, that there's so much that you have in front of you that you're failing to reach for them. Or you put your head in the sand and you're an ostrich and you don't want to realize that it's really about the things that you do. So we're going to talk about a little bit about the anatomy of the brain. And we're going to talk about how it all works together. But I want you to think about something. We're talking about a hard mass, something that you can put your hands on. And if you go into any of the textbooks and you look at anatomy of the brain and the spinal cord, what you're going to see are these different parts, things called the frontal lobe and the parietal lobe and the occipital lobe and the temporal lobe and the cerebellum. So we just talked about things called the cerebrum before that, and then the brainstem. And all of those make up that computer that runs you. Without that, nothing works. It's located in your skull, right, between your two ears. It weighs about 3 pounds, plus or minus. It's responsible for all kinds of things, from all your senses, sight, hearing, touch, taste, smell, emotions, thoughts, movement and control of the brain, your perception of things, your predisposition to things, all of those things. The right side of the brain controls the artistic part of you, the musical part of you. The left side of the brain controls the detailed stuff, the calculating portion of your brain. There are 3 parts, as we talked about: cerebellum, cerebrum, and the brainstem. Okay, so put that aside. That's a lot of anatomy, and those are things that you can look up, and if you sitting there in front of a computer, pop it up, take a look, so you can see what we're talking about today. But really what I want to talk about is the neurophysiological dysfunction that occurs because of stuff. What kind of stuff? Well, stuff means injury, and not directly to the brain, but also to the spinal cord itself. Yeah, if you have a spinal injury or you have irritation to the spine itself because the vertebrae aren't lined up the way they're supposed to, it will affect the brain and its capacity to work. Think about that for a second. You didn't touch your head, but you messed up your spine, and now all of a sudden you see that your brain's not working the way it's supposed to. That happens. We're going to talk about a little bit about environment and all the things you put in your body, the things that you're exposed to. And we're going to see how that all comes together. So from the front part of your brain, where you have all the decision-making processes, and by the way, we talk about, and we kid young boys about that, the frontal portion of the brain, they have no frontal lobe. That has to do with the ability to know that there are consequences to your actions, and many of you don't have that capacity to understand that what you do has an effect, and that's not necessarily a fully developed frontal lobe, but in fact it relates to that. The side portions of your brain towards the back, we call the parietal, that's your intelligence. That's your reasoning. That's your sensations. Those are your capacity to read things, right? The occipital lobe, all the way in the back of your head, That's your vision. That's your ability to see things. If you get a blow to the back of your head, you could lose your eyesight. There's a lot of people historically that have had perfect vision, and subsequently they get a blow and that's it. Andrea Bocelli is one of them. He got a soccer ball to the head, and guess what? Vision's gone. He's blind. That happens, and sometimes it's immediate, sometimes it takes time. Temporal lobe. We're talking about emotions. We're talking about behavior. We're talking about hearing, those types of things, language as well. So anything that affects these areas are going to affect your capacity to exist and to retain. And all the way, that in the way that these things are rigged, by the way, they communicate one to the other, to the other, to the other. All of a sudden, you lost that word. You can't find it. All of a sudden, you knew you were going to do something, but you walk in the room and you forgot what it was. So your body reacts the same way, by the way. Heartbeat and physiological reactions. Your heart begins to misfire. Is that to do with the heart, or could it be spinal cord and brain related? Now remember, the brain and the spinal cord are encased in bones. Your skull has 22 bones, and they move as you're breathing out, right? And the spine has vertebrae, bones, that protect it and protect the exit of the peripheral nerves, these little electrical wires that go out to every place. So if that system is not balanced properly, if it's not aligned the way it's supposed to be, if it's being irritated mechanically in some way, then your nervous system affecting the physiological system of your body, not happening the way it's supposed to. So we have to make sure that we understand the interconnectedness of all of this stuff. Messages are carried from the spinal cord to the brain, and from the brain to the rest of the body and down the spinal cord. So it goes back and forth. It's not isolated in one thing, and that's sometimes we forget, and we try to isolate these things, and we look at things in compartmentalized situations. Doesn't happen that way. Your body is, your capacity to work, much, much greater than the sum of the individual parts that we want to focus under a microscope and say, this is the cause. Well, that ain't it. So we're going to talk a little bit about that today. Obviously, a broad brush and things that, we want to relate. But what I'm going to do is that, if you've noticed the type of program, every other week I have a guest generally, and we talk about different types of problems. Next week, Dr. Scott Lamp will be my guest on the program. We're going to be talking about GERD. So if you got any kind of gastroesophageal problems, next week is the week that you really want to pay attention, because that's manifesting. They can affect all kinds of things. But also I wanted to make sure that we really understand the neurology of the body and how it works, because this whole new paradigm, the brain-body connection. But do we really get it? Do we really understand it? I'm going to try to get you so you can do that. But meanwhile, I want to answer your questions. 888-630-9625, and let's talk about it. But in the news, before we get that, one other thing showed up today before we get into the topic, and I want to kind of bring it to your attention, is there is an increased risk of fat. It's called obesity. That really big tire you got around your belly that increases your risk of all kinds of things, including you're going to die young. And it's not okay. But what we're finding, and what we've known clinically, perhaps anecdotally, is that if you don't have enough of B complex, B vitamins, you're going to increase your risk from childhood on of being too fat. And when you think about it, we should be getting it from our foods, but our foods are so devoid of all kinds of things. They're void of everything that's not in the matrix. Our ground is wasted because we keep replanting. We don't put anything back. We're going into GMOs. We have hybridizations, and we strip everything out. Then we process it. All this white, nice flour that you get has no B vitamins to it anymore anyway. So even if you're going and eat and you think grains, white this, white that, they're all gone. But subsequently what happens is you get to be too fat. And there have been tons of studies going from, in this country, Journal of Clinical Nutrition, to research that's been done overseas. Do your homework and realize that, in fact, you are the caretaker of this, and the number one vitamin that they keep putting their fingers at is B12. So you go to these fat clinics, right? These medical clinics that are going to do whatever, and they inject you with B complex and get it super high, and that's supposed to expedite this and accelerate the burn of fat within your body. Does it work? To some extent. It increases your BMI, the way your body burns calories, but nevertheless, it's not the only piece. There's another thing called thiamine, B1, and riboflavin, and all these guys together work in harmony, orchestration, to begin to burn fat. Why is this such a problem? Because you can be a thin, fat person, and you got a lot of fat in that abdominal area, and you're holding on to things. Your hormones go down, you hold toxins. It's all part of the same mechanism, same puzzle. So understand that, again, we are the direct production of our own ineptitude sometimes and our own unwillingness to take control of our heads, of our life, of our bodies. 888-630-9625. We're talking about brain and dysfunction within the body and the things that you can do about it. There was an interesting article that I've read and reread a couple times, and it came out of the University of Maryland, School of Medicine. And the title was, "Do Spinal Cord Injuries Cause Subsequent Brain Damage?" Well, I'm going to give you the end of the story first. And the conclusion was absolutely yes. Most research on spinal cord injuries have focused on the effects due to spinal cord damage, and scientists have neglected the effect on brain function. And in my field, in chiropractic and osteopathic medicine, we've known that effect minimally, anecdotally, for many years. So University of Maryland School of Medicine researchers found, and they said for the very first time, poppycock, that spinal cord injuries can cause widespread damage and sustained brain inflammation, and there's the key, swelling of the brain, and it leads to progressive loss of degeneration of the cells of the brain and associated problems with cognition and depression and so forth. And that was their focus. But you know what? It can cause so many other things as well. So it goes on and talks about, and it republished, by the way, in the Journal of Neuroscience, that the other cell cycle is what they talked about it, links spinal cord injury and loss of brain function and suggests certain types of treatment, some of which I don't necessarily agree with, but that's another thing. But they did all this, obviously, in animal studies, and they showed that traumatic brain injury, even mild repetitive injuries, can cause progressive brain damage, tissue damage, and subsequent cognitive decline. And the other piece that has been missing for a long time on any spinal cord-related area, there's tremendous chronic inflammatory process. So if you're in pain all the time, if your back hurts, if your neck hurts, that's a process of increasing inflammatory irritation within the body. And remember, structural, chemical, emotional, right? Those are the only three things that can cause anything. Injury, biochemical imbalance, and stress. All of those things come together to cause this cascade we've talked about of inflammatory reaction. And in this particular situation, we're talking about brain cognitive decline, loss of capacity to do certain things, loss of reflexes, ability to stand properly, and so forth. And pain that just never, ever, ever goes away. And depressive-like behaviors that we just don't know where they're coming from. What does that mean? That means that you are depressed all the time, that you have anxiety reactions, that you have things that you don't know where they came from. So it's an interesting article. For those of you who like to read, check it out. University of Maryland School of Medicine, and it'll give you all kinds of information relative to that. We're coming up to a break, and when we come back, we're going to not only give you a whole lot more information on the subject today, because I think it's super important, and I'm going to take the time to do diligence to this over a period of several weeks. We're going to touch a little bit of this, a little bit of that, and we're also going to take your phone calls, which you're lightening up the lines now with, and I will never ignore you. I want to get your things squared away as fast and as specifically and readily as I possibly can. By the way, I want you to go online, go to rosellecare.com. That's ROSELLECARE. Scroll down about halfway and check out Have a Heart. I'll tell you a little bit more about that later on. Don't go away. You're talking about brain and spinal cord dysfunction. This is Dr. Tom Roselle.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend GERD and Digestive Disorders with Dr. Scott Lamp on Wednesday, February 4th at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. Call me, 888-630-9625, 888-630-9625. Love to talk to you. We're talking about brain and cognitive decline and injury patterns and what makes you go, I don't know why I walked in the room type of thing. Before we do that, Debbie, how can I help you? Thank you for calling.
Yes, this is off topic, but a couple of weeks ago I tripped on a curb and landed on my knees. And ever since then, I cannot kneel on one of them because it feels like I'm rubbing it in shards of glass. Is that something that you or someone in your office can help me with, or do I need to go to orthopedic surgeon?
A couple quick questions. First of all, how many couple weeks ago?
2.
Okay. And is it getting better or is it staying the same?
Same.
Is it swollen?
No.
Okay. Have you had an x-ray?
No.
All right. So the short answer is maybe. It depends on what's there. The first thing, we'd examine it. We check the muscle function around it. The kneecap, when you fall down like that, is going to be irritated. And the kneecap is, this pivotal thing right in the middle of the two bones of your upper leg and your lower leg. And you've got a big tendon that comes across from the thigh muscles and it attaches to the lower portion of the bone. So any impact to that can cause several things. It can cause a slight break of the superficial layer of any bone called the periosteum. This is a wrap around. It's really like saran wrap. It's very tight, very thick, very heavy. You could crack the bone. You could off-center it so the muscle's not firing the way that's supposed to, so it'll feel exactly like you're describing. But the only way that you can really tell is through an examination process. And if you came in, if we tapped your kneecap and it was sore, the first thing we're going to do is send you out for an x-ray to find out and rule out any of those things. In the meantime, you can go to the health food store and get something called Traumeel, like trauma, Traumeel, and it's a gel, and it's a homeopathic application. Worst case scenario, it's not going to hurt you, and best case scenario, it might take care of some of the irritation. Rub it on a couple times a day. Now, do you have any problems going upstairs or downstairs?
No.
Okay, so it hasn't affected generally the muscle. So what I want you to do is try that. If you don't notice something within about 48 hours, give us a call. Yes, we can help.
Okay, great. Thank you very much.
Deb, thanks for calling. Appreciate it. 888-630-9625. That's 888-630-9625. We're talking about brain injury. We'll get to your phone calls, I promise. We're talking about something that seems to come out of nowhere, but in fact, it has multiple causes of dysfunction. And you really need to understand what the patterns are and where they're coming from. We just told you a little while ago that if you had any kind of spinal cord injury whatsoever, that it's going to affect the brain because of the cascade of inflammation and subsequent degradation, breakdown, if you will, of the cells of the brain. And then anything that is absent in nutritional form makes it even worse. So let's say you have an injury or you have an exposure to something, remember structural, chemical, emotional, or it's a repetitive, constant type of thing, then pretty soon your body is not going to be able to adapt. So we need to understand why the brain atrophies. And you may be losing actually as much as about 0.5% of your brain mass every year. It's like huge. So the rate of brain shrinkage actually increases, but does it increase because you're getting older? Or does it increase because you keep stacking things one to the other over a period of time? I have an opinion, and I think it's a split decision. As your hormones begin to drop, you're going to have more of a problem with neurocognition, your ability to brain to work, also the ability for your body to heal. So if your estrogens and testosterones particularly begin to go down the tubes, you're going to see more neurological problems. Now, does that have to happen? it drops somewhat with age, but it doesn't have to crash. The problem is we live in a society that we're constantly being exposed to all kinds of things, from all xenoestrogens that are floating around the atmosphere, the radio waves that come in, from low-volt electromagnetic fields. What do I mean by that? Your cell phones, the towers that are around us. You live in a hot box in Washington. You've heard me say that many times. That's all going to affect those things that we're talking about. So we see this cascade of bad food, environmental stimulation, repetitive injury and trauma that we put up with. We don't step up to the plate and deal with. But there's every study out there that shows older adults with significant brain shrinkage are much more likely to have cognitive decline, going into things like, by the way, not only Alzheimer's and old age dementia, but also Parkinson's and things of that type of process. And there's a reason for that. And we're going to talk about those reasons when we come back after the break. But in atrophy of the brain can be very specific relative to regions. How does that happen? Well, we just talked about trauma. Shrinkage of the temporal lobes is associated with a huge increase in depression. So if you ever had a blow to the head, car accident where your brain's rattled back and forth, and even at 10 to 15 miles an hour, that can bounce your head off the sidewalls of your bony, container. And that will cause an inflammatory reaction that is going to set those things up. So if you're younger, with overall brain shrinkage, you have about a 70% increased risk of dying too soon. That's not okay, right? And, if people who are like 85 plus and, they have associated frontal brain atrophy, they increase their risk of dying very badly by 60% with all kinds of neurocognitive dysfunction. We're going to talk about the genetic risks, something called ApoE gene, and what that means. And there's all kinds of risk factors, but the point of it is you can control that if you take the steps that you need to take, not putting up with pain, chronic, not putting up with putting less than adequate things in your body, making sure that you're stimulating the brain and working it. That's just one piece, by the way. But we're going to get into that very, very specifically, but I want to take your calls. There's several of you online right now. We will go to the phones when we come back. 888-630-9625. That's 888-630-9625. And trust me, this is something that you can affect. You can turn it around. But you have to understand what it is you're trying to affect. Don't go away. This is Dr. Tom Roselle.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yes, I'm in studio. Give me a call, 888-630-9625. That's 888-630-9625. Want to remind you, my guest in studio next Sunday is Dr. Scott Lamp. We're going to be talking about GERD problems and digestive dysfunction and what happens when you actually go on a protein pump inhibitor, a proton pump inhibitor, not a protein pump inhibitor, a proton pump inhibitor. Anyway, it causes all kinds of far-reaching problems, and sometimes the consequences are not good. And by the way, what we're talking about today has a lot to do with that as well. Talking about brain dysfunction as it relates to trauma. We said earlier that you can have a spinal cord problem where you've misaligned your spine or the skull bones of your head, and that cascade, that constant pain, that dysfunction will cause an inflammatory reaction that will cause brain shrinkage and incapacity, inability for your body to work neurophysiologically. It's absolute. We talked about a study from the University of Maryland. Look it up. There's one out in Queensland, Australia, that was very, very cutting edge. I read about that this last week every time I see an article on something. But this is an area that's very near and dear to my heart. Why? Those of you who've listened now for a long time know that I was in 2 very serious accidents over the last decade. And so subsequently, there was a time that if you had listened to the program on ongoing basis, that you would say, what's wrong with Dr. Tom? There's something not measuring up the way it should there. And I was doing the and those kind of things. I was having a really hard time coming up with word process, and there was a reason for that, and those were because of the brain traumas and then the subsequent pain patterns that affected my spine. Over time, I was able to treat that, and I'm back and, being as obnoxious as I usually am to everybody that comes around. But nevertheless, you can reverse this stuff and actually increase the brain cognitive pattern again. So let's talk about these things a little bit. But first of all, I better pick away at your calls, because if I don't, we're going to leave a lot of people hanging. Laura, you've been sitting there extremely patient. How can I help you?
Thank you, Dr. Tom Roselle. I have a friend who has diabetes, and she's taking, the injections, for the diabetes, and she had a heart attack recently, just a week ago, and she has fluid in the lungs. I don't know how this is treatable, and they are giving her Lasix, which damages the kidney as far as I know.
All right. It damages a lot of things, Laura, but let me touch on it very, very quickly and try to give you some guidance. As always, you can get a hold of us after the program and just send me a note. But here's the deal. Lasix is a diuretic, and it pulls all kinds of things out, including potassium and other minerals. It causes an imbalance in the system. It'll cause dehydration if the patient is not careful. But when you have fluid buildup in the lungs, we have to know whether it was before, after, or both, relative to the problem that she sustained and suffered. You have to balance the body. That we're talking about a trauma to the nervous system. And that we're going to have high levels of inflammation. Curcumin is one of the things that may help. Vitamin B complex is another one that will help. B6 is a natural diuretic. But again, she's not my patient. I don't know her health, and I can't tell you specifically what to do with her, but I do know there's other things. Acupuncture, low-energy light laser, those things can be extremely useful in turning this type of situation around. The application of B complex with coenzyme Q10 at a very high level, and there's other things as well. But again, I don't know enough, and whether the swelling was directly related to the brain injury, whatever, I can't tell you. So, but send me a note. The more information that you can tell me, Laura, the more that I'm able to be specific relative to the case. Betsy, how can I help you? Thank you for calling.
Yes, sir, Dr. Roselle. Thank you so very much for taking my call. I'm in need of your wisdom and your opinion. I've had the flu for a couple of weeks, and it went right into a toothache. I just went to the dentist this past Friday, and he took x-rays. He did pull the tooth. It did have a small pus pocket on it, but he said the x-rays showed up a small polyp in my sinus, and he thought that I needed to see an ENT, and I needed your opinion.
You know what? That polyp has been there for a long time, and it wasn't a result of what just happened. So here's the thing. Could it be complicating drainage? Perhaps. But more importantly, it's not one of those knee-jerk, oh, my God, I have a polyp there, let's take care of it. It's probably directly, what it does tell you is this, that there's an imbalance going on in the tissue, and the membranes are not clearing the way they're supposed to, and you're getting some cellular degradations. A polyp in the nose or a polyp in the rectum are similar in their characteristics. One's harder than the other, but nevertheless, it still sends a signal to the body that there's something that is not appropriate. So just taking the polyp out doesn't necessarily solve the issue. It's like people come in, well, my doctor just found all kinds of polyps in my nose and he wants to take them out and so forth. So my question is, when did they notice them? Is this the first time you've ever been to the doctor? Did you have them when you were a young person? Or a deviated septum, the same thing. Well, they got to straighten it out. Well, why are they straightening it out? Well, because I can't breathe. The better question is, why can't you breathe? What is it that you're doing in your diet and your environment that is causing the nasal tissues to inflame to such an extent that this blockage now is so obstructive that it's not allowing things to drain out? So we go to, we look at diet, we look at atmosphere, we look at injury to the nervous system, a lot of things we're talking about right now. So all I can tell you, Betsy, is that, first of all, there's another question behind the presence of the polyp. You need to find out what your overall health status is. If the polyp is obstructive, if it's big and it's putting pressure on the nervous system, the brain, or it's going down into the optic areas of the brain as the optic nerve comes out to the eyes, different story. But it doesn't sound like it to me. Okay. Send me a note at drtomroselle.com or rosellecare.com, and my staff will get it to me, and I'll ask you a couple more questions. But I wouldn't jump. Okay.
I really appreciate that. And one last thing. When I was 3 years old, my nose was broken. It was like split, and they were never able to reconstruct it or anything. So I'm 60 now, and my nose, that bone comes over in that area.
That could be part of the problem. That could be sinus drainage problem. But again, Betsy, I go back to saying this to you.
The diet.
Yeah, it's
Okay.
if your membranes are clear,
Okay.
and you've been doing well up until now,
Yes, sir.
then let's look at some other problems.
Thank you, sir, and I appreciate that, and God bless you.
Thank you. Appreciate it. I need it. Linda, how can I help you?
Roselle?
Yes, ma'am.
Hi. I actually had a recent fall. I'm an older mother, and I have little kids. And I just had a recent fall on the ice, and I hit landed on my bottom. And about a week later, I was just taking a quick nap, and I basically couldn't get up. And I was just curious is that a muscle thing? Because it went away the next day. And then it happened again a week later. Just the other day, I couldn't basically move after like a 20-minute nap.
Yeah, what's happened, Bessie, I can tell you straight up, you've compromised the lower portion of your spine, so the nerves are being irritated. So you get into a position where the muscle guarding that you have because of an injury like that is gone overboard. It causes the spinal vertebrae to move out of position. It doesn't have to be significant, but just slightly. We're talking millimetric misalignment. It's called a spinal subluxation in chiropractic. And so what happens is the nerves get tweaked. Now, you get into that position, perhaps the muscles get tighter again because you've weakened some opposing muscles, and you try to get up, and there's no power in your legs and your back and your buttocks. So it's telling you that there is a spinal injury. Fortunately, that can be treated. The fact that you can get up and move afterwards and it comes and goes like that. The problem is it's going to come more often until it's treated specifically and properly. And you need to have it evaluated, and very specific structural evaluation and treatment, manual manipulation, and you can get rid of this thing. But the longer you let it stay, the more defined and specific and destructive it'll be.
Okay, I really appreciate that.
You're welcome. Thank you for calling. Appreciate it.
And I have a mother with Alzheimer's on top of it, so I've got the whole kit and caboodle.
You know what? Send me a note, because I'm going to tell you some things that you can do naturally to at least help your mother. There's a lot of very strong, supportive, anecdotal stuff that's available to you, and I'll tell you who to contact in addition. But give me some more data. I'd love to be able to help you.
Oh, sure. Same number then, or
yeah, just go to RoselleCare.com and send me a note, and I will get back to you.
Okay, thank you.
You're welcome. Carol, how can I help you? Thank you for calling.
Just wanted to comment. At 4, I became epileptic, and I had 10,000 seizures growing up, but I went to Hopkins one year, and they did the right temporal lobectomy, and they took the whole right side out. But I fell 6 months later, and nothing happened. But a year later, and this is just in relation to what you talked about, I had 3 dozen grand mal seizures in 2 days.
Yeah, unfortunately that's what happens. The brain begins to miscommunicate, and the interconnections, one to the other, begins to be degraded, if you all use that term. So, for example, I'll go back to my own problem that I had some years ago. 8 years ago, my wife and I were in a head-on car accident. We were hit by a Dodge Ram as we were slowing up for a light, head-on, 55 miles an hour. And prior to that, 2.5 years before that, I was coming off an escalator in Las Vegas at the Flamingo Hotel. I was facing backwards, talking to one of my staff members. Both of my heels hit simultaneously on the old lip of the escalator, threw me back. I flipped over. I was trying to break my fall, and my head in a marble pillar. Okay?
Wow.
So those two things caused a lot of problems, not only joint dysfunction and pain patterns and so forth, but my cognitive considerations were not as sharp and capable as they used to be. So over a period of time, I had to be very specific. But what they found was my right frontal lobe was not communicating, taking short-term information and sending it to my back portion for storage. And it was funny, not only that I was misstepping, but if somebody asked me what I said on the radio 48 hours later, I couldn't remember unless you told me what the topic was, and then it all came back. So
I had that problem. They took 10 inches out when they did the surgery.
Yep. And fortunately, the brain is a mirror image of itself, and you can reprogram other areas of the brain for it to work, but you've got to do it nutritively through stimulation, and there's brain mapping and other things that can be done, and you can get that settled down, but you've got to look at the chemistry, you've got to look at the structure, you've got to look at the energetics. There's hope. You just have to go into the right circles. If we can be of help, please let me know.
Okay, thank you very much.
Thanks for calling. Appreciate it. 888-630-9625. That's 888-630-9625. Love to talk to you on anything. I always have an opinion on something, one piece of it or another. Anyway, listen, it is my opinion, right? Most of things out there, I take information. My strength, if you will, is I take a lot of data and I can put it together very rapidly and apply it and give you the capacity to be able to think through things. And that's what you have to do. Remember, I've said over time, never believe anybody, not even me. Well, sometimes. I mean, the point of it is that you need to do your own research. You need to go out and make sure that it's appropriate for you, that you get it, you understand it. We have in-house continuing education programs. We do them every other week. Those are for you. Those are for you to show up, ask the questions, understand what's going on. My book, Ageless Health, Health is a Do-It-Yourself program, is all about that. Go buy it if you don't have it. It'll take you through the process of being able to discern what happens in your life with your health, your capacity to perform or inability to perform, to be able to think or not think. All of those things are important. Mary, how can I help you?
Thanks for taking my call. I was recently diagnosed with thyroid dysfunction, and I'm a loyal listener, and I just wondered what you would suggest that I can take natural...
Mary, what kind of thyroid dysfunction? Do you have a Hashimoto's thyroiditis? Do you have a Graves' problem? Do you have just a slow-reacting thyroid? What's going on with it?
It's a slow-acting, I guess, because they don't... it's strange. The doctor didn't tell me.
Well, that's not okay. That's step number one. You need to know what's going on. See, the problem... Here's the deal. You get a laboratory test done. You tell your doctor, I'm tired. I'm run down. I don't feel the way I'm supposed to. He'll ask you a couple questions. You get cold. Is your brain working slowly? Things that say thyroid, but it may not be at the end of the day. So what you have to know is what the problem looks like. Unfortunately,
I'm fine.
I'm sorry?
I'm fine. I'm a surprise.
You know what? Send me, Mary, scan if you can, or send it by mail. Send me your blood work. And,
How can I get that?
Ask your doctor for it. You paid for it. You have a right to it.
Okay.
Okay? Anybody that has anything done, particularly in this environment, you have a right to that information.
Well,
and
I didn't want to. I read the description of the medicine. It scared me. It was like
it should.
And I couldn't do it, so I got the natural thyroid medicine, and then I went back to the doctor after 7 weeks, and he said to me that it was not improving, that he would have to prescribe more stronger medicine. And so I told him that I'll take the original one, but
Mary, send me the information. Let's take a look at it.
Okay.
I'll be more than happy to help you.
Okay.
Appreciate your call. We're coming up to a break in a short time. There's a couple more of you on the line. I will try to get to those things. Gentleman just dropped off about brain bleed. I will make a comment about that, even though that you left us. And a couple others there that I want to get to. We're going to talk about brain dysfunction, neurocognitive disorders, how they affect you, why they come from trauma, why they come from nutritional aberrance, if you want. I use that word meaning that you're not getting the things that you need to have, or you're getting too much of something, you're being exposed to something that you shouldn't be exposed to. The bottom line is there's a fix. You can do things better. You can make life a whole lot easier. And we're going to talk about that every other week for a while until I get as much data to you as I possibly can. And as always, you want to get a hold of me, go to RoselleCare.com. We're coming up for a break. Don't go away. I have some more things I think you'll be interested in. This is Dr. Tom Roselle.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live in studio, same old spot every week, 12 o'clock, right on your dial. Give me a call whenever at 888-630-9625. I do this for you. This is why I'm in the seat right now, because I want to stimulate you to take control of your own life, for you to have the capacity to understand that it really is all about you and nobody else, and to be less than that, I would be doing you a disservice. So make sure that you take the words that I give you on a week-to-week basis, go research them, go look at them, send me notes, join us whenever we have a educational program, whether it's in-house or outside. It's all about giving you the resources to be able to improve the index, the quality of your health. We have another call online. I'm going to go to that. Barbara, how can I help you? Thank you for waiting and being so patient.
Oh, hi, yes, thank you. If a person cannot get enough calcium because they cannot take dairy foods, etc., I just read recently that calcium supplements, which you need to take, some of them have lead in them, and it's pretty frightening. If that's accurate, what kind of calcium supplement should one not take or, in fact, be able to take?
Okay, first of all, the majority of the world should never drink, eat dairy products, period, if they're refined and they're not organic. And the majority of us, after we're done suckling, should never have anything that has to do with milk itself. However, goat's milk and sheep's milk is more like mother's milk. They're easier on the body, but we want to have them either in a raw form, whether it's yogurt, whether it's cheese, whether it's, that sort of thing, but in very, very small amounts. It's not something that you're going to get. You get more usable calcium from green vegetables than you do from any other source of calcium out there. So it's a combination of things. So you have to be very careful. Having said that, years ago, we used to think that women needed a tremendous amount of calcium in their body. Then science showed us that we were probably causing more problems because if they weren't using it, they were actually going to store it in their arteries and causing plaquing. So then we realized that magnesium was necessary, and sometimes a 1-to-1 ratio or more magnesium than calcium. Then we realized that vitamin D was necessary. People weren't getting enough sunlight. They weren't getting enough exposure. Then we understood that you needed other things like boron and strontium and now K2. So you have to put the combination of things together to get adequate absorption. Diet and absorption of minerals start with the ability of your body, particularly your stomach, to produce enough digestive enzymes stimulating reflexes within the colon. Now, if your gut is irritated because you're eating things you shouldn't and it's swollen, then you can't absorb this stuff. It's just going to go through you or break down. Most calciums that are good for you are naturally based organic sources. You go to places like Mom's and Whole Foods and so forth, and you ask them for a low-level calcium that is specific. Calcium carbonate, as we get older, is almost impossible for us to break down because we don't produce as much hydrochloric acid, and hydrochloric acid is the number one digestive product that we need to absorb calcium. You don't have it, you don't absorb it. And if the gut is irritated again, you're still not going to absorb it. So calcium, depending on what the person's general overall health pattern, things like calcium citrate, microcrystalline epoxide apatite. It's a calcium that goes specifically to the bone. Calcium lactate, much more functional with muscle patterns and so forth. And the list goes on. A calcium citrate form, which can be absorbed because it has more of an acid level to it and it binds quicker in the body, but you've got to get these things in. Anyway, Barbara, I wish I had more time to spend on it. Send me a note. I'll get more specific with you, but thank you for your call. I appreciate it. We're coming up to that fateful time, which means I got to leave you, and not that I want to, because I could sit here and talk all day long. And I want to thank many of you who showed up last week at the Angelica Film Center and joined us for the Ageless Health PBS twice-nominated Emmy Award special. We're going to do it again in a short period of time, probably sometime late spring, so keep an eye out for it. As always, whatever I can do to help you, please let me know. That's why we're here. That's why we do what we do at the Roselle Center for Healing. There's so much that we can talk about in such little time. We have to make this program much longer. See you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Have a Heart, February 16th through 21st, and join Caring for Others Ltd. and the Roselle Center for Healing in collecting non-perishable food items for our local food bank. Inventory is very low, and our community has many needy families. In appreciation for helping us during our Have a Heart annual charity event, the Roselle Center for Healing offers you a choice of services as a special thank you. Call 703-698-7117 for more information or visit rosellecare.com.